So just talking about PT blocks, with this it's important just to review the anatomy. What you can see is the medial malleolus here. That's the saphenous nerve. Remember there's 6 nerves around the ankle: posterior tibial, saphenous, deep perineal, which is deep to the ankle joint capsule at the ankle level, medial and lateral perineal nerves, sural nerve. That's all there is ever. Yesterday I did a osteobunionectomy on the 1st and 5th, and second come to MIS, and that patient had a second and third met cuneiform exostosis, so I blocked the saphenous, the deep perineal, the medial lateral superficial perineal branches, and did the midfoot pump first. The top of the foot will be numb for 36 hours from that. So knowing where the nerves are really good for checking out for entrapments, and I think a lot of that gets missed by our profession, and it shouldn't be. In regards to heel spur, what you need to remember is that the posterior tibial nerve will split into 2 branches, so anywhere from 6 or 7 centimetres proximal to the tip of the medial malleolus, distal to that. This is from Serafian, if you've seen his anatomy text. So anywhere from about here, it will split into medial lateral branches. And then from there, the medial branch of the posterior tibial nerve and the lateral branch will pass through the upper and lower calcaneal chambers. This is also described in Serafian. And these calcaneal chambers are fibrocartilaginous tubes that the 2 nerves run through. That's where tarsal tunnel happens, here deep inside the foot. So this is obviously the heel bone. The adductor hallucis starts down here at its origin, turns into muscle belly all the way to here, and turns into tendon and inserts into the first MPJ. Over the adductor hallucis is a fascial band that goes on the other side of the adductor hallucis between it and flexor, digital and brevis. And there's fascial bands in between all of these over the muscles, and they connect up to the fascia. So if you have chronic inflammation of the fascia, you get nerve entrapment if it's there long enough. The upper and lower calcaneal chambers will get constricted, they get tight. Okay, so tarsal tunnel doesn't happen here. If you see someone who's had a tarsal tunnel release and there's an incision right up here, it's because the surgeon didn't know where to look, particularly if the incision doesn't go up to here. Anytime you do a tarsal tunnel, we'll start about here to identify the normal nerve. The incision has to go on the course of the medial lateral branches right up into the arch of the foot. That's got a number of implications, and what this is supposed to represent is the medial calcaneal nerve the first branch or lateral plantar nerve. This is actually medial, that's lateral going lateral to the foot. This will tie into what I'm going to talk about in a second. So the lateral plantar nerve has its first branch, which goes deep into the foot, and it goes between the heel bone and the origin of the fascia. That's why the spur hurts, usually. It's because the nerve branch is going inside there. In my entire career, I've taken 10 heel spurs out, and I've done about 100 fasciotomies. So the spur isn't usually the cause of the pain. It can be, but it's not usually.